All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. My apologies, my computer crashed just before the start. So here I am. Let's start our discussion. Surprise, surprise that CDC has been hiding or not publishing large swaths of data, especially the booster data related to hospitalizations in the age 18 to 49. And their thought is that if they had presented that data, we would have misinterpreted, the people would have, the doctors, the peoples, we would have misinterpreted the data and somehow thought that the vaccines are ineffective. That was their reasoning. Honestly, the science should simply mean that if the data shows that these things are ineffective, then say these are ineffective. Or if they do not have any advantage on an age group, then say this age group does not need it. So let's look at that. Plus, I also was talking about discussing the Israel's dashboard. So we'll do that today as well. It is also especially interesting in the context of today's discussion that we have been, by we I mean the experts in the US, not the CDC and FDA folks, but outside of those, the external experts, they have been using Israel's data and UK's data to make decisions. And here is our own agency sitting on the data that states have been pushing to them for years, not publishing that data. You would see Pediatric Association being upset about that. You would see that the wastewater data processing systems being upset about it. Then you would see that the hospitalization related to age 18 and 49, that data being not fully shown. This is the situation. Okay, so let's start. So I have to give kudos to Apurva Mandavilli. She is the one who wrote it uh, for New York Times. Here she is, and she joined them in April 16, 2020. And here is a groundbreaking work. I went over this report, and I thought, all right, couple of paragraphs are going to be the basic meat of the discussion, and then the rest is just going to be fluff. And look at my highlighting. I had to highlight almost every sentence. This report is so rich. And I had to deliberately leave parts out because everything was red. This is how good of a work she has done. And I also wanted to share with you what is the end result of all of this. CDC said, now we got $1 billion, we would improve our systems. Really, this is their way of behaving? I'm sure that somebody said, why did you not do this? Or why did you do this kind of a behavior? And they said, well, our systems are not really up to speed. FDA goes to the court and says, we don't have enough people to give you the papers, the documents. CDC goes and explains somewhere and says, we just don't have the money to do the work, and give us more money and we'll do. From now on, we'll start preparing the things. I remember some of the bigger companies in which I used to work, that at the higher levels, these are the kind of things they would do to delay and to knock down certain things. And so now we got the $1 billion today. Maybe 2 years later, we'll have the data. By that time, it won't really mean anything. So I'm going to go over some parts of this report. I would request you to read it. I cannot thoroughly present that, but I'm going to show you some interesting data points. No pun intended. And I did download some of their reports as well. And yes, it is correct. For example, in this report, I'm sure that it looks really, really tiny. But if I increase the size of this one, look at this. It is from 2021 week 38, that is September, and onward. And you would see various ages here, all ages 65 plus, 50 to 64, 18 to 49. And then you would not see the data below or before this time. However, I'll show you CDC's data as well, where some data is from January last year, some data is from June, other data is from October, some data is from November. It seemed like CDC decided to publish. Apparently, this is how it looks like. CDC decided to publish the data that would suit their narrative. And it just is so clear that the only narrative they have is vaccine. They have nothing else to offer to the help build trust, educate the nation, the people, and then have a partnership with people to provide the best possible protection for various groups, ages, races, comorbidities in various correct ways. So let's see. I was showing you this data just to say that I downloaded this data as well. So let's go over some of their messages, and then I'm going to show you their data too. So this is a report by, so we are in the Omicron time. This is a medical disclaimer. There is no medical advice here. This is Apporva Mandavilli. I hope she does not sue us for the picture that we use. This is from New York Times. She works there. Excellent report. I loved it. So here is what they're saying. So these are excerpts from the report. For more than a year, the Center for Disease Control and Prevention has collected data on hospitalizations for COVID 19 in the United States and broken it down by age, race, and vaccination status. Good. They got data for more than a year. And there are states that had been pushing data to them for a long time. But it has not been made, it has not made, it being CDC, it has not made most of the information public. When the CDC published the first significant data 2 weeks ago on the effectiveness of boosters in adult age younger than 65, it left out the numbers for a huge portion of that population. I'll show you some of that data. 18 to 49-year-olds. The group the data showed was least likely to benefit from extra shots because the first two doses already left them well protected. So the push to healthcare workers in this age group to go get the third dose, the push to youngsters to go get your boosters, anyways, this report speaks for itself. I want to show you some data as well. So this is Apporva. We talked about her. I'm going to take this out. This is the CDC's subscribe by. This is New York Times. This report is good. I do not know the rest of the system. So here, look at this. Rates of lab confirmed COVID-19 hospitalizations by vaccination status. Good. So it's a pretty interesting headline that, okay, they're going to show you by vaccination status the people and the rate of hospitalization. And then look at this headline. 8 times higher. This is the hospitalizations. 8 times higher in unvaccinated adolescents 12 to 17 years of age. So that is one message. Then 12 times higher in unvaccinated adults 18 to 49. So you can look at that and say, well, they are providing data. Here is 12 to 17 years. Here is 12 times for 18 to 49. Here is 17 times for 50 to 64. Here is 17 times for 65. Believe me, as you see the data below and you see how it seems to be cherry picked, you might just say, you know what, from now on, just look at Israel's data or UK's data. This is actually manipulated data. That's how I feel. That is my opinion. So let's look at it. Age-adjusted rates of COVID-19 associated hospitalizations by vaccination status in adults ages greater than equal to 18 years. January 2021 to January 2022. So 1 year. But look at this. Down here, there is no information about a booster. And why am I saying that? You could say that, why are you being fussy about, I want to see boosters? Because they have boosters in other reports. So if I go here, for example, or this report, you would see here data for boosters. In here as well, you would see some data for boosters too. So this is a very selective data and look at forget about what data is showing for the time being. Let's look at what data is used. So here, 1 year worth of data, no boosters here. Okay. So the blue line is unvaccinated people and the green line is vaccinated. So boosters are gone. So could you say that they do not have the boosters data whenever the boosters started? I don't think so. I think they have the data. That is what this report is saying. They have the data. Rates of COVID 19 associated hospitalizations by vaccination status in adolescents aged 12 to 17 years, June 21 to January 22. How come all of a sudden the data has become limited from June? And if you see here, once again, this is rate in fully vaccinated and rate in unvaccinated. Boosters data is once again not here. And the overall data is also limited. It's from June. Okay, so you say, fine, maybe they have the data from June. Let's give them that. And then if you go down here, this is boosters now. And check this out. Look at the data for boosters. So you could say, well, the charts above that was actually not boosters, overall vaccines. Fine. Let's look at the boosters. Age equal or more than 18. Start of the data, October 21. Do you see the trend before? It actually seems like it would have been very different. This is what Apporva is saying, or New York Times is saying. They have the data. They're just only partially showing that data that fits the narrative. Or I'll show you what their representative said what. The representative said they feared that people would think the vaccines are ineffective. So the data was not ready for prime time. This is not a prime time show. You just put the data out there and let people and experts and doctors and communities and hospitals make a decision. They are making decisions on what the CDC is showing. Based on that, people are getting fired. Based on that, people are getting shamed and embarrassed and tainted and their careers being destroyed. Okay, so this is October 21. Let's see this. Now, can you see this? So here, age 18 and above from October. Age 18 to 49 from November. November to January, that's all the data they're showing you. November, December, January. That's it. That's the data. Where is all the rest of the data? Apparently they have it, but we can't have it. I have the links to all of these. You can go and see them. The point today is not to go over the data. If you just wanted to see, the data is here. But this is from November 18 to 49. Above 18, all is October. So tell me this then, how can they make these broad claims when the data is limited? At least make it, for example, if you want to show it from November, that is a minimum set, then show all the data from November. Why is that November only 3 months of data they have or they're showing? Here they have from October. Here they have from June. But if they have it from June, then there is no booster information. Here they have it from January. But if they have it, then there is no booster information. And what is their answer to this? Well, we didn't have resources. Our systems are old. Our systems are broken. We were not able to do it fast enough. So now we got $1 billion. Now we'll do a good job. Guess what's going to be the next message? I've been in technology for some time as well. Next message is going to be, We are using that $1 billion. We have gotten the contractors, we've gotten the engineers, we have gotten the system being built. It's going to take 2 years to build it, or 3 years. Then we'll start showing some of the data. That's what I think would happen next. Okay, so look at this. This is the vaccine effectiveness. So everything is nothing but the vaccine effectiveness. Vaccine effectiveness. Infection 3 doses versus 2 doses. So that is exactly booster, right? And then you can select various views. And down here, they're saying a booster dose increases vaccine effectiveness against SARS-CoV-2 infection, including against the Omicron variant. Fine. And then here is the data for you. This is the data. Somewhere here in from December to mid January, something like that. That's the data. And down here is hospitalization and various studies that are showing various data. And you can do a by age group and you can see this. And once again, the data is in these chunks. If you go here, this is actually even more interesting. Look at this data. This is, so how do I reach these pages? One, I have the links, and secondly, if you go on to the left side of this menu, it says vaccine effectiveness and breakthrough surveillance. And when you, or vaccination delivery and coverage is above, this is the one, vaccine effectiveness and breakthrough surveillance. If you open this menu, in here there are various categories for vaccine discussion. Rates of COVID-19 cases and deaths by vaccination. So you already saw hospitalization. And this data, hospitalization, you tell me, how much confidence did you develop after looking at this data? When I looked at the headlines here, I said, all right, so they have this data and they're showing some results here. And then you scroll down and you look at the data, and wherever they want to show something, the data points that may not be congruent, that data point is just missing. Here, the booster information is missing. And if you go to the booster, then the larger swath is missing. Okay, so I'll come back to this in a second for the age groups. I want to just show you some more of this, the excerpts from this Apurva's message. Kristen Nordland, a spokesperson for the CDC, said the agency has been slow to release the different streams of data, excuse me, because, check this out, because basically at the end of the day, it's not yet ready for prime time. Really, we are in the middle of a pandemic. We are dying. We are getting damaged. There is long COVID. There are injuries. There is depressions. There are suicides. And you're waiting for data to become ready for prime time. She said the agency's priority when gathering any data is to ensure that it is accurate and actionable. Okay. Another reason, so this is another reason, is fear. So CDC is afraid that the information might be misinterpreted. Nordland said. Well, here is what's going to happen. We see information from Israel, we use that. We see information from UK, we use that. We have already lamented that US doesn't have enough information. We never misinterpreted the other informations, or let me say it this way as well. If somebody is going to misinterpret the information, they're going to do it regardless of the data. But there's a large swath of people who would benefit from this data for their decision making. This data would allow them to go speak with the doctors to say, here is the data I'm seeing. What is your help here? So they were afraid that the data will be misinterpreted. Don't you think that this situation itself and the lack of data itself caused so much of the churn in the society? Then they said, but the CDC has been routinely collecting information since the COVID-19 vaccines were first rolled out last year. So that is, what was that? 2020 December time frame is when these started rolling out. According to a federal official familiar with effort, the agency has been reluctant to make those figures public. Reluctant to make those figures public, the official said, because they might be misinterpreted as the vaccine being ineffective. Just don't show the data. Ask them to go get the vaccine. You look at the data, you'll say vaccines are not working. We can't let you say that. So just go get your vaccine. Oh, and as much as people use this against me as if it is a mistake, I am a pro vaccine person. Even for these vaccines, I love messenger RNA vaccines. I have Moderna both doses. And so you bring such people as well who are generally who like vaccine, you bring them to the stage as well that they start looking at this and say, looks like you have just messed up everywhere. The CDC has received more than $1 billion to modernize its systems, which may help pick up the pace, Nordland said. We are working on that. Then they say, again, kudos to Apurva. She needs a lot of respect for this. Some states and localities had been sharing wastewater information with the agency since the start of the pandemic, but it had never before released those findings. And cities, so one benefit of the wastewater data is to understand if an outbreak has occurred in a community. And so there are so many flags that can be triggered before the community actually exhibits the symptoms. The flags can be triggered by the wastewater indicators. Never showed that data. This, I don't think they were deliberate in hiding it. I just think they were just being lazy. So Apurva says that this data that was missing could help states and elected officials to make better decisions. Booster information could help for age based decisions. Without the booster data for 18 to 49 years old, the outside experts whom federal health agencies look to for advice had to rely on numbers from Israel to make their recommendations on the shots. So this is not a ding to Israel. Israel has done, I would show you their dashboard. I really am enamored by the work that Israel has done. And here, our experts are saying because we didn't have the data, we were looking at Israel's dashboards and their data to make decisions. And here, our agencies had the data, and they were afraid we'll misinterpret that. Really, we are treated like babies, not even babies. Last year, the agency repeatedly came under fire for not tracking so called breakthrough infections in vaccinated Americans. I think you all remember this one, and focusing only on individuals who become ill enough to be hospitalized or die. Remember, that was the May of 2021, if I remember it correctly. Was it May of 2021? Yes, where they had said from now on, end of May, they said after end of May, we will not treat any infection in a person as a breakthrough unless they are hospitalized. I remember discussing it because folks would ask questions that, hey, what does this mean? Are they trying to hide it? And I would say, yeah, sure, it makes sense that the hospitalization is a more serious thing. So they would see how many people are becoming hospitalized. But yeah, they did change the data. The agency presented that information as risk comparisons with unvaccinated adults rather than provide timely snapshots of hospitalized patients stratified by age, sex, and race and vaccination. And even now, if you look at their dashboards, or it looks like vaccine sales dashboard. So it also has been difficult to find CDC data on the proportion of children hospitalized. This is what made me more angry and upset. And this is again from the report. So, children hospitalized for COVID 19 who have other medical conditions, comorbidities, said Dr. Yuvan Maldonado, chair of the American Academy of Pediatrics, Committee on Infectious Diseases. The Academy staff asked their partners at the CDC. So, this is Pediatric Academy asking CDC to give us data about children for that information on a call in December, according to a spokesperson for the AAP, and were told it is unavailable. It's safe and effective. We are protecting our people. Who would you like to protect more than children? They've known this for over a year and a half, right? And they haven't told us, she said. I mean, you can't find out anything from them. And guess how we were making our decisions? We were looking at the data from Israel. Once again, thanks to Israel. So it's not a bad thing. But again, Israel is a different community. Their dynamics are different. Their socioeconomic statuses are different. Their uh, society's behaviors are different. And we were applying those to us because we didn't have our data. Turned out we had our data. It was our data. It was with our agency who was afraid of displaying it or who was unable to display it. Just like FDA goes to the court and says, we don't have people to publish documents. So with this, I want to share this dashboard as well. So this is rates of COVID-19 cases and deaths by vaccination. So hospitalization is a separate one that we already saw. This is cases and deaths. And if you see this dashboard, here what they do is they say overall, age group, vaccine product, and there are rates of cases and deaths. So you can go to cases or you can go to deaths. So if you see here, this data actually starts from somewhere here in April and then continues onwards. If I remove select all and just say 12 to 17, for example, this is the data now vaccinated, unvaccinated, and fully vaccinated. That's the data they have. And it starts from April. If I go to 18 to 29, then once again, unvaccinated and fully vaccinated. That's the kind of data they have. And when is it from? It is from April. So this is the cases. If you go to deaths, then once again, there are no boosters here. And this table down here does not change because they just have a standard blurb from overall. Ideally, it should have been great if we said 18 to 29 and show us this difference for them. So check this out. It doesn't change. So you actually do not know this kind of a number. So if you come down here for boosters, then the data they have is 18 to 49 here, cases and deaths, and look at the beginning of it. It starts from September of 2021. September of 2021. You can't see the data before. Or maybe, at least if I am looking at this, I'll say, well, there is no data before. Apparently, they have the data. And how difficult it is that you can actually display that data, but not display months before. And the messaging is we are trying to make sure it is accurate and actionable. Actionable is not their job. Presentation of the data is. So 18 to 49. Why do I keep harping on 18 to 49? Because if you look at the Israel's dashboard, you would see, I have to refresh it. You would see the breakdown. It is such a beautiful way of breaking down. So if I go here to Actually, I should just show the whole thing. So this is the data here: 18 to 49, 50 to 64, and 65 plus. And the data starts somewhere from September. Now, let's switch gears. Look at the Israel's data. You would find it even more interesting once you see it in this context, that we are shown data from January or June or October or November or September, all over the place. I think based on whatever part fits a specific narrative is shown. I don't believe in this that we are not ready to show the data because it is not, um, we don't have technology. Here's a technology. It is shown in technology. What, to show 2 more months, the technology will have to change now. Okay, so let's look at Israel. Totally different topic. But check this out. So somebody says, Apurva must be desperately trying to redeem her shoddy and inaccurate reporting. Well, this report is, uh, unless this itself is wrong, then we are all just, the whole thing is then messed up. Okay, look at Israel. And this dashboard has been out there forever. I'm going to go to isolated children trend moving average 7 days. Let me see if I can make it bigger and not break this system. Come on, come on. Yes. So I was hoping that it will become one at a time. So now there is this huge, big. Sorry, guys, I have to show it this way. Where are we? Okay, so I'm gonna once again navigate through this. I wanted to enlarge it. Look at the breakdown. This is the verified children trend moving average 7 days, and it is pediatric disease. Look at the breakdown: 0 to 4 years, 5 to 11, 12 to 15, 16 to 19. Now compare that to us, or partially less data shown, and 18 to 49. 18 to 29 is the range in which the messenger RNA vaccines can cause myocarditis with a larger percentage. I would suspect that we would focus on that group. 18 to 49 is a very large swath. And if you start taking averages of that huge group, you'll see all things kind of averaging out with each other. And here, look at Israel: 0 to 4, 5 to 11, 12 to 15, 16 to 19. That's how they've shown the data. Isolated children trends, moving average 7. And then they have these trends. Again, today it's not about what is the data itself, but how well the data is curated and presented. Pediatric morbidity in relation to general morbidity localization. So here is that data. Then they have morbidity from abroad, residents who entered Israel. Then a trend of verified people who entered Israel, verified who enter Israel by countries, various countries, and the data from them. So I want to continue, look at this. This is the effect of immunization on morbidity, daily verified immunization. So this is that data. Then severely ill. So let's look at this data for a second. So severely ill, they have above 60, under 60, and they have breakdown separately as well. And then per 100,000 or absolute numbers. Isn't that a beautiful way of showing the data. The only thing is the in the responsive state, it doesn't work very well. But here is the data. Day by day, there is data. So our experts have been using these dashboards to make decisions. Look at this. So you saw under 60 above, 60 above, and here is 5 to 11, 12 to 15, 16 to 19, 16 to 19, not 18 to 49, 20 to 29, 30 to 39, 40 to 49, 51, 10 years at a time. They're so impressive. Active patients, age and immunization, active patients per 100,000. And I know folks who have even been criticizing this dashboard. So, seriously ill and hospitalized, hospital conditions, deaths. So, let's look at the. So, this is last month, 39 diseased, 48, so on. Daily deaths immunization by immunization status. And they have been doing it from ever. We have been looking at sales data. So look at this. If I can go here, if I go to near the edges, the this thing starts breaking down. So this is Saturday, February 19. Unvaccinated 10.7, vaccinated without booster, I do not know the number, vaccinated 0.7. So let's go here. 9.6, 2.4, 0.5. And you can keep seeing there are times when data look good in one way or the other, but they're presenting the data. Tests. One thing that I really loved over here, so this is the number of subjects by age groups. R naught. Look at the R naught. So their R naught or reproductive number has dropped below 1. It is sitting at 0.67. You know that if R naught is 1, I know that you know it, so sorry for saying it that way, that's just rhetorical. R naught of 1 means that the infection has become endemic and it is just going from one person to another, not from 1 to 2 or 4 and so on. So it's not spreading or growing, it is spreading with equal um, rate or incidence. And then if it is lesser than 1, then it is winding up. One person is not able to give it to more than to one person. So there are multiple people infected to be able to get infection in a smaller group. So the pandemic or the infection is actually on the decline. So R naught is actually reduced. Can you imagine this? 0.67. I wish I knew US is R naught. And so more data here. Look at this. Look at this. Age and sex. So age 0 to 9, 10 to 19, 20 to 29, and then males, females. So I guess you get my point. I'm just now talking more about these things. Um, I actually cannot believe it that such excuses will be used by the country that is the most, at least I believe so. I live here, it's my country, I love it. I believe we are top notch, we are world class, we are one of the best. And so our resources, our behaviors, our methods, our processes are followed the world over. and we would do better. I had tweeted this out today, that this data that was withheld, I'm sure that they would come back with reasons that it was just very innocent and it was just very impractical for them to be able to release it. But during this time, if boosters were not needed for a certain group and that data was withheld, data was there but withheld, and if people were pushed to go take boosters or they were inclined to go take boosters because they believe in all this, and if there is any injury, who is responsible, who is accountable for that? Okay, so Janet says Dr. Bean is disappointed. I get it. Thank you very much. um, okay, so let's stop for now. Please like, subscribe, and share. And there is a link in the description that is for Dr. Bean's drbeen.com plans. So the lecture's there, and that's a very, very discounted price. I think I always, that's not even the price for one video. But if you would like to become member of the drbeen.com, use that link. And there are links as well for if you would like to support this by buying me a coffee or using PayPal or becoming a patron, you will be, you're very welcome. And I would see you in a few minutes for chit chat. In today's chit chat, we'll decide the new chit chat channel's name. I'll present to you various names that have been suggested with higher votes. So see you soon.